Hello and namaste everyone. I think now we can start. So I am Medha Sharma. I am the FP2020 Youth Focal Point from Nepal, and I run a youth-led organization called Visible Impact here in Nepal. So I'd like to welcome you all to this wonderful discussion that we're going to have today. It's part of a series. It's the first part of the series, Stay Safe and Stay strong and stay standing. So to let you all know about this session and what the series is for, and for introducing about IAWG, I would like to invite Katie Meyer from Interagency Working Group on Reproductive Health in Crisis, IAWG. Over to you, Katie.
So thank you, Medha. I'm going to actually turn it first to Samantha for some logistics if you need to know which channel to be on before we get started. Samantha, over to you.
Thanks, Katie. Hi, everybody. I'm going to put these instructions in the chat box as well, but just a few things before we get started. So you should see a Q&A box where you can submit questions throughout the webinar. So please feel free to add questions in English or in French. Speakers will be sharing their video during this call instead of any presentations. So to view the speakers' videos, look at the video panel on the right-hand side of the screen. You can select the options on the top to either see the speakers in active view, gallery view, or gallery view grid. To only view, we don't have slides actually, so please ignore that. Of course, if you have any technical difficulties, please use the chat box where you can send chats to all attendees or to the meeting hosts. And in the event that you're unable to reach us or need to use email, you can email my colleague, Emily, at esullivan@familyplanning2020.org. We'll put her email in the chat box. Finally, with interpretation, today's webinar will be in English, but there will be simultaneous interpretation into French. I'll share the instructions for French translation shortly in French, but everyone also needs to select an English channel if you're listening in English. So to do so, please look at the bottom of your Zoom screen and locate the globe icon that says interpretation. And please select your preferred language, English or French. And if you're choosing French, you can click on mute original audio if you don't want to hear the English narration in the background. And then finally, if you're on an Android or Apple device, in your meeting controls, you'll tap the three dots, then tap language interpretation, select your language, and you can toggle mute original audio. And I'm just going to give these instructions very briefly in French before we get started. Alors, le webinaire, c'est en anglais, mais il y aura une interprétation en français.
This webinar is going to be in French,
Avant de commencer le
in
webinaire,
English with a simultaneous interpretation into French.
Avant de commencer le webinaire, chacun doit choisir une option linguistique. Regardez en bas de votre
Before
écran
starting, everyone
et
should
trouvez
pick
l'icône du globe
their
terrestre qui
language. You
indique
can select
interprétation.
this on the world icon.
Sélectionnez votre langue préférée, l'anglais
You
ou
can
le
select
français.
your preferred
Si vous
language, English
choisissez
or
le
French.
français, vous pouvez couper le son
If you
original.
choose
si
French,
vous,
you would be
si
able to
vous ne
mute
voulez
the
pas
original
entendre le
audio so you
narration
don't
en anglais.
hear the original
Si
and you
vous êtes
only
sur
hear
un
the
appareil
interpretation.
mobile, Android ou Apple, appuyez sur les trois points. Ensuite,
You
appuyez
can
sur
click on the
l'interprétation
three dots and then
en anglais ou
select
le français.
mute original
Si vous
audio
avez des
if you
questions à
like.
ce sujet, n'hésitez pas à les poser dans la boîte de discussion.
If you have questions, please type
And
them
finally,
in
this
the
webinar
Q&A
is being
box.
recorded. Thank you again for joining us and for your participation. Katie, over to you.
Great, thank you. So welcome, as Medha said, and for those of you unaware of IAWG, or the Interagency Working Group for Reproductive Health in Crisis, it is a coalition of more than 20 members that make the decision of the group, and then it has over 2,000 individual members from nearly 500 agencies. It is committed to advancing the sexual and reproductive health of people affected by conflict and national disaster. So why are IAWG and FP2020 doing this webinar series? Well, we've been talking to young people, youth organizations, and local organizations, and we want to listen to what you need right now, and that is some operational support. So we've brought in different INGOs and local organizations to speak about how they are dealing with staff safety, our topic today, as well as really how you manage different things organizationally with COVID in our very first session. And that ranges from working remote to dealing with communications with the donor. So we're going to get to a few of those topics today. And then at the end of this session, I'll also be talking about a funding opportunity that's associated with this series. So I'll give it back to Medha so that we can get started with our Q&A. Thank you.
Thank you so much, Katie. And I hope you guys will stay with us till the end to hear more about the funding opportunity, because that sounds really exciting. So today we have 4 wonderful speakers, and I'll be introducing them as we come to their question. So first, I would like to introduce you to Saro Imran. She is the Youth Focal Point for FP2020 for Pakistan. So Saro, I want to hear from you, your experience with your organization, and particularly the challenges that COVID-19 has brought, and of course, your personal experience about contracting COVID, and then how you survived, and overall the challenges that COVID-19 has brought to your organization and your personal experience. Over to you, Saro.
Being a youth community-based organization with limited resources and limited capacities to deal with the crisis like pandemic that has impacted the whole world, it was a thing, and we got some support from the big organizations in terms of providing technical assistance and providing some in how to when COVID-19, being CEO of an organization. Are you hearing me?
Yes, Saro, we can hear
Hello.
you. I can hear you, Saro. We can.
Just to be clear, sorry, if those of you who have hit a mute original audio, you should unmute that, because the original audio is now English. And so you want to unmute original audio, and then you should be able to hear Saro. Thanks. Go ahead, Saro.
Okay, so I was just telling that being a transgender community-based organization in a country like Pakistan, it was the very challenging experience to deal with the crisis. And while we are providing HIV prevention service delivery to transgender people, and which you cannot stop despite of the lockdowns, because service delivery should not be interrupted. That can impact the transgender in terms of accessing contraceptives and other prevention measures while for the prevention of HIV. So our role was doubled during the crisis. Like, we have to provide the HIV prevention services as well as giving away on a voluntary basis to the community members who are living below the poverty line, the transgender people, for the HIV, for the COVID prevention, and for some local resource mobilizations to donate hygiene kits as well as foods and nutrition supports to the transgender community, because 95% transgender people in Pakistan lost their source of income due to COVID-19 and lockdowns. So it was a challenging time, but what was positive is that being a community-based organization, we have sense of belonging among us, that we are from the same transgender community, and we have a trust level that we are in this to no matter what, we will face together, we will stand together for our community despite of limited resources and limited capacity. And I myself contracted COVID-19, and it was like the situation got more challenging, and you have to operate being a head of a community-based organization, and you have to operate the things from home. and maintaining your health, not only the physical health, but also emotional and psychological health, and being the role of a leader, that you have to lead the community who is looking forward to you in this crucial time. And I fortunately recovered COVID-19, and I feel that I have more responsibilities now to prevent my other community members from this uh, uh, pandemic. So we voluntarily start mobilizing some resources on university level, community level, and providing food and nutrition support, as well as hygiene kits and some IEC material in local language to raise awareness among them. What is COVID-19? How you can prevent COVID-19, and that was my personal experience, being a person who has experienced COVID-19, being a person who is from the transgender, being a person who has community-based organization in Pakistan for transgender people. So we managed to successfully sustain ourselves in the crisis and maintaining the balance for providing HIV prevention services as well as COVID-19 prevention awareness and helping them as a first aid or like a humanitarian relief in terms of providing food and nutrition support, especially to the HIV positive transgender people, because they are on more risk of having to get COVID-19 due to compromised immune system. So yeah, but I think that it was a challenge as well as a learning experience to, because I feel that we can now more strong community-based organization, because we have suffered from this crisis, and now the situation is getting better in Pakistan, and the lockdowns are lifted out, and things are getting back to normal. I feel that the one thing that was very important and very supportive in the whole journey is the sense of belongingness that we have among the transgender people, and being truly a community-based organization.
Yeah, thank you so much, Saro. And I would like to congratulate you for, being able to survive COVID-19, firstly, and for all the achievements that you have been able to gain, even at this time of uncertainty. And as a president of a youth organization, I can resonate to so many of the things you shared, because the challenges are very similar. Now, for example, the organization that I run, we are these days very often discussing about the uncertainty of funding, and because we don't know how the pandemic is going to progress, and how do we communicate this to staff. There are times when our staff is not willing to do certain field activities. So it's nice that Pakistan has lifted the lockdown, but for Nepal, it was a little bit different. So first we had a lockdown, and then the government lifted it for a few weeks, and then the cases started rising rapidly. So now again, we are going back to we are in the lockdown model. So there was a lot of confusion for us in between whether we should resume the organization or not, or how do we maintain staff safety and so on. So yeah, so to all the audience, I think if you're also facing similar challenges, then I think today's discussion is going to be really worthwhile. Having said that, I would like to introduce to you our next speaker. Our next speaker is Dr. Michael Ibelly. He is the Regional Humanitarian Advisor and part of crisis team with UNFPA. So Michael, welcome first of all to this series. And I would like to begin by asking you, so as you heard from Saro and also my experience that, it's really difficult to communicate to staff about their safety, because sometimes people are not taking COVID as seriously, or there's often misinformation, or people do not have access to scientific data. There might be language barriers, or simply as a youth organization, young people might be overwhelmed with so many information coming up in the social media. So, Michael, I would like to hear from you. How do you think youth-led organizations and CBOs should communicate with their staff about their COVID-19 updates?
Yeah, thank you. And first, let me begin by congratulating Saro and for a job well done, or doing a job very well in the present circumstances. And his speech talks to the challenges faced by organizations. One, whether people take COVID seriously, but also when COVID begins to affect organizations by individuals getting affected, then that has a big challenge. He talked about not being able to reach to the people who need their services because he was down with COVID. But in terms of communicating to youth-led organizations, or like any other organization, I think at the beginning of the pandemic, when the pandemic was still in some of the areas in Asia, what was important to communicate to people is that what is COVID? What is COVID in terms of disease? How is COVID spread? And what can COVID look like? Because potentially that is where some of the challenges come around, because COVID presents like many other diseases that are already present in the societies. But also it's important for us, I think, to communicate to our staff that people will fall sick with COVID. Some people may not fall sick with COVID, but most importantly that we are not exempt from COVID even within the organization. And by speaking by the mode of transmission, our work itself exposes us to risks. You just had the story of Saro. Most likely he contracted COVID during his interactions with the community. So I think it's important to communicate what is COVID, how is it spread, what can it look like, because COVID can look like many other things. But then most importantly, what is critical to communicate, people look at COVID in terms of the numbers. What are the numbers of the new cases? What are the numbers of people dying? And people like to localize this to where they operate from. So we must have access to that information. The other challenge most of the time will be that people will think that the information is somehow not correct. You have people accusing governments of building up figures around COVID. So we must be able to get people access to the official sites for COVID-19 information in terms of the number, the location, and then the sicknesses and the deaths from COVID. The other critical thing is people want to look at how far are we going, or what does the situation look like in terms of moving ahead. You've heard stories about vaccines being developed. Again, this is information that we must be passing on to our members of staff in terms of what are the scientific approaches going on in terms of control of COVID. But most importantly is that the proven preventive measures actually do work, and those are at the hands of everybody to practice: social distancing, respiratory hygiene, the use of masks, and so forth, and then seeking care for people when you fall sick early. So I think if we focus around that, then we will be able to localize COVID and make people actually appreciate that it is a risk to all of us, but most importantly that there are many things we can do to actually prevent COVID. And if we do them rightly, then we can prevent COVID. And should we fall sick with COVID, then there is a big chance that we can actually recover and get back to our work. The story of Saro speaks. Thank you. Over to you.
Thank you so much, Michael, for highlighting on the importance of communicating correctly and passing on the correct information to our staff. And I would like to remind all the attendees that if you have any questions to any of our speakers, you can already start typing them in the Q&A box, so that we will have some time for the Q&A at the end of the panel discussion. So now I'd like to introduce you to Harrell. He is the Chief Operating Officer of Save the Children. So Eric, I would like to hear from you, because Michael just shared about how it's important to communicate correctly with the staff. but also how do we, communicate about safety? So, for example, there might have been so many changes in the organization. There might be changes in local travel policies, or, like I shared, whether we encourage people to travel because the work demands it, or, think of staff safety in the first place. And if there are things that cannot be like neglected, it has to have travel, then how do we, communicate these things to the staff? So basically, how do we communicate about safety to our staff? Over to you, Eric.
Great, thanks, Medha, and thanks for having me on this panel. This is an exciting topic and, of course, very timely. So in terms of communicating with our staff, we've had a few ways of doing this. We have had regular weekly coronavirus Q&A calls where all staff are invited to participate through a big Zoom meeting. We have on staff, we have a very experienced public health expert who will walk through with people the latest public health news related to COVID. We also have on that call our safety and security officer who will discuss any issues surrounding safety and security for staff. And we have myself on the call who talks about any operational issues or policy issues that are coming up. And so that's one way that we have managed the communications with staff. We've also every week followed up that Q&A session with an email from me for anybody who wasn't on the Q&A calls, and that goes out to all staff to explain to them what the summarizing basically the call and any other information that we need to convey to staff. So those are the two main ways that we have done it. We've also, just in terms of some of the things that we instituted as part of COVID, we early on decided that we wanted to institute something we're calling pandemic time off, which allows staff who are dealing with child care or elderly care, or in other ways are unable to work because of the pandemic, to take up to 2.5 hours a day and build that time to what we're calling pandemic time off, so that they can take care of their personal lives and take care of the things that are important to them, so that they can and still continue working without having to take their own leave time. And we've also been very upfront about letting people have as much flexibility as they need to do their jobs. A lot of people are working a longer total amount of or a longer period in the day, but the same amount of hours in the day. Or some people are working on the weekends instead of during the week, just to allow them to take care of family and schooling and everything else that has to do with their job. So anyway, those are just some of the things we're doing, some of the things that we thought have been helpful for communication to staff.
Thank you so much, Eric. Indeed, these are all, kind of no cost interventions, and that can definitely be replicated by youth organizations and CBOs as well. But again, another major challenge that we see in the organization is also about the project and the funding. And to speak about that, I would like to request Kunta Ture. Kunta is the care member of Youth Network West Africa and the CEO People and Culture Manager. And Kunta will be speaking in French. But the question that I have for her is that, at this time of uncertainty, when we do not know like what the funding is going to look like, so how do we communicate to the staff about our funding status and our projects? Kunta, over to you.
Hello, everyone. I join my colleagues, Michael, Saro. Thank you so much for your presentations and what you said. It's true. The arrival of COVID-19 has affected so many organizations. It's not been easy. The policies, and from a management standpoint, really the impact on the capacity of our organization to respond to these challenges. So facing the financial uncertainties, first of all, when COVID arrived, the first action we took was to officially inform our funders. We explained the situation to them. So we had to explain to our funders. We also wanted to obtain their agreement, not only for the financing, but also the mission of our staff. This was determinative because the funders responded positively. They asked us to adapt ourselves, adapt our activities, and to make a proposal about our activities, the activities that are in fact implementable. So when we had received the funders' insurance, international funders' insurance, then we were able to reassure our staff, first of all, that all of their jobs would be maintained. But we also made proposals to concerning how we plan to organize the staff. And then we explained that we were going to put certain staff on leave, but also facilitate teleworking. So staff had the assurances that they were not going to lose their jobs. And in most of these countries and areas are still developing. This was really important, and this was not this is a very stressful time, and this was quite reassuring to them to know that they could hold on to their jobs. After having reassured our staff that about our different operational changes, then we made some proposals about the activities that we could handle and carry out. However, in order not to break or hurt the staff morale, the youth network that was in place we produced videos for all of the staff, which permitted sort of interconnection among the different organizations, but also and personnel. But we were able to put the focus on COVID. For example, I made a video about hygiene, how to wash hands, etc., all kinds of necessities during this COVID era. And this was, believe me, there was such an interest in this initiative that was put in place by the youth of CARE. So actually the CEO of CARE International, Michel Noon, this was great for the staff morale. And this avoided our focusing only on COVID, and this helped as a motivation. Also, another motivation for staff was we would have weekly virtual meetings, and we'd hear from each person, and we shared news of each person's family, and that people were doing well, and psychologically and morally, this really helped people. These meetings, virtual meetings, allowed the staff to know that not only is management there for them, but the entire organization from the top down is interested in their health and safety. And that we were on top of managing this crisis. And this was all to keep the staff morale high. And it helped enormously.
Thank you so much, Kunta, because and congratulations, because your funder was very willing to make the adjustments. But this might not be the case every time, especially for like youth-led organizations. Our projects are like 1 year long, and then we already had 7 months of lockdown. So they allow some extensions, but then again, it's sometimes very difficult to adjust programs if they are for a very short period of time. But thank you, Kunta, for sharing your experiences. And maybe, Sarah, if you want to add anything about these things that we are discussing right now, whether you have been facing similar kind of challenges, or if the situation is different for you.
So yeah, when it comes to resources and fundings, I guess like the small organizations and the new youth-led organizations and the organizations that are community-based, like Transparent, for example, the marginalized communities, have less access towards resources. Because like in case, like we tried to mobilize some funds from the donors, but uh, they send a list of documents that they need in so they can provide us funding. That was not possible, being a like a less community-based organization. So I believe there should be flexibility of crisis that towards funding youth organizations and small organizations, because they are working on the grassroots level, and the most affected people in crisis have a direct relation with the grassroots level organizations.
Yeah, thank you, Sarah, for sharing that. So maybe now I can turn to Eric. So Eric, you just heard from Sarah like how COVID-19 is so much stigmatized, but then there's another thing associated that's about staff welfare, and especially about the mental health issues that are coming up. And sometimes the staff might not be very comfortable to share their concerns, or sometimes they are not even able to identify that they are going through certain kind of discomforts. So, how do we encourage staff to share their concerns, and keeping them, like understand that them sharing their concern might not affect their performance or evaluation within the organization. So, how do we share, how do we encourage staff to share their concerns with each other?
Sure, thanks for the question. So I think there's a few ways. First, it starts at the top. We established early on that we wanted to make sure that we had a culture of caring and understanding of our staff's needs. This included some of the things that I mentioned before in terms of some of the additional benefits that we offered to staff as a result of COVID, but also we made sure that people were aware of the mental health resources that we have available through a provider that we have named Conterra, which provides counseling and other support for people who are going through a tough time or who need that kind of support. We also I've made clear to managers in the company that, or in the organization, that we want to make sure that they are flexible with their staff, and that that they should be allowing staff to take whatever time they need to take care of themselves. We also have encouraged people to take time off. A lot of our staff are very dedicated, and in the absence of being able to go on vacation to, the beach or something because of the COVID restrictions, a lot of people have not been taking time off, and we've been really encouraging people to make sure that they do take their regular leave, just vacation. I mean, I myself last week was off, and my vacation consisted primarily of moving from the right side of the couch where I do my work to the left side of the couch where I do my relaxing. But we've been very much wanting to make sure that the staff are taking care of themselves, and so those are some of the things we've been doing for that.
Yeah, thank you for sharing about that. So maybe I turn to Michael. So Michael, Kunta just shared that there was time when she had to ask the staff to be on leave. But there are also times when, because it's been like 7 months since the lockdown, that organizations have to decide to lay off certain staff because of lack of funding. And at this time, it's already very difficult for staff, because of the COVID and everything. And then when you communicate the layoff, it's even more challenging. So can you share with us, like, how do you communicate the staff about their layoffs?
Yeah, thanks. And you raise a very important question. I think overall, we need to be looking to be sharing with our staff socioeconomic impact of COVID, not just on individuals, but on families, on nations, but most importantly on our organization. And I think as we've moved through the last 6 months with the pandemic, there are certain things that have been happening. We have been seeing funding streams going down for the organization, but most also we have been seeing that some of the activity, we're not able to conduct some of the activities because of the restrictions in place. And then that means that there is no way we can be accountable to our donors for those activities that we have not conducted, even when we have tried sometimes to repurpose, but also to do those activities in a way that does not infringe on the regulations for COVID-19. So I think when staff have this constant communication about the potential directions, the programming, funding, and donor relations going within the organization, then it makes it much easier to communicate at the time when you realize you have to send people either on leave or lay off people. So it's about making staff understand that it's really the impact of COVID-19, and again, it's not related to their performance, it's not related to anyone being followed up for victimization or losing their job. So like Eric mentioned, part of the update we need to give staff are not just about COVID itself, but the impact of COVID on the organization. Then that way they can be able to be prepared for some of the news, some of the bad news, which inevitably we have to pass on at one time. Thank you.
Thank you so much, Michael. Indeed, so we have to start communicating and updating our staff from the very beginning so that it doesn't come as a complete shock to them. So as a follow-up question to what Eric shared, we have a question from the chat box, and maybe Kunta, you can take this question. So Irene is asking, what are the psychosocial effects observed so far among the staff and attributable to COVID-19? So Kunta, have you seen such kind of, psychosocial effects among your colleagues?
Est-ce que je peux répondre?
I can answer to that.
Est-ce que je peux répondre?
Can I answer to that question?
Allô, vous m'entendez?
Can you hear me? I'd like to answer to that question.
Allô, vous m'entendez?
Can you hear me?
Yes, I can hear you.
Yes, Kunta, we can hear you.
Donc, pour répondre à la question, oui.
So to answer to your question, yes, we've seen some consequences on the morale of our personnel, our staff. I'd like to add something to what Saro said about the youth-led organizations that lost their financing because they lost the trust of their donors. So our organization works with local NGOs that have seen their activity go down due to COVID. So our youth network has suggested to these NGOs to work together. These NGOs are mostly working with young boys and girls who left school. And they are also working on women empowerment, youth and women empowerment. They were not able to carry out their usual activities. So we suggested to them to start making masks on the local level with they had several workshops with, you know, making clothes, cutting people's hair, and doing such things. So we suggested to them to start making some masks because they lost some of their activities, such as doing people's hair. They could not do that anymore due to the pandemics. So this is why we suggested to change their activity to start making masks for the local community so that they could have a new source of income. So we looked for somebody, for a professional that could go and train them. The people who didn't know how to use a sewing machine, they were just applying the logos on the masks and they were packaging them. And these activities allowed the local NGO to have a new source of financing and to have extra source of income, because all of the larger organizations were also cutting their local activities. And in the Mopti region, you can see that for Save the Children, for example, when school started again, there was a high demand of masks. I sent a presentation in which you can see locally made masks that were used. Some UN agencies have also ordered masks from us, and the income was so large that they didn't even feel any problem from the COVID crisis. They've also made some soap made of shea butter. It's very popular in Mali, for example. And because everybody was washing hands so many times a day, then they were able to sell these shea butter soaps. So this local manufacturing of products was really crucial for the survival of these organizations.
Thank you so much, Kunta, for sharing with us how, you know, staff who might not have other jobs or have lost their jobs can take alternative actions to support COVID and also generate resources. But I'm also wondering, you know, about those staff who have to work with their laptops, or probably they will be working from home. So I would like to ask you, Eric, you know, for those staff who have to work from home, you know, how do we shift the operations to remote work? Because firstly, it's about staff accountability. How do we ensure that they're actually working, you know? And secondly, about the logistics that comes with it. For example, the finance staff need a lot of printers and, you know, scanners, and then, you know, so if they're working from home, that'll be really challenging. Some of the staff might not have laptops or like desks, for example, or even internet connection, good internet connections. So yeah, how do we shift our operations to remote work?
Yeah, so thank you for the question. I think at Save the Children anyway, nearly all of our staff are working remotely at this point. We had previously issued to all of our staff laptop computers, so they were able to take those home when we all started working from home. And for those staff that needed additional equipment in order to do their job, like printers or scanners, we've just gone ahead and purchased them for them. So for us, that particular question hasn't really been that much of an issue. We've also allowed staff, particularly those who work on lots of Excel spreadsheets and stuff, for whom the small screens of the laptops aren't sufficient, we've allowed them to purchase, and we reimbursed for monitors, which are larger screens for them to be able to do their job. So that's really how we've approached that. It's been remarkable. People have been remarkably resilient to the changes in the working environment, and have continued to work, if anything, probably more than what they used to when they were working at the office. So we haven't had the issue of needing to check in to make sure people are actually working. That's not really been an issue. We've trusted them to work, and they've continued to perform. So.
Yeah, thank you so much. One of the challenges that my organization has been facing is also about bringing staff back to work after such a long time. So when the government decided to lift the lockdown and we decided to start the office, because many other organizations were doing that as well, but that doesn't necessarily ensure safety, because then public transportations were on and the staff were not willing to come through public transportations, and then so they were they needed additional travel money or something like that, which is really challenging for youth-led organization like ours. But also the decision itself to make about when to resume office. So Michael, maybe you can help me with that by explaining like how do we transition back to working in the office safely.
Yeah, thank you. And the return to office normally comes up with lots of dimensions that you'll observe amongst the staff. One, there will be staff definitely who will have anxiety about coming to the office, concerns around their safety in the office, concerns about moving away from the new normal that they have been used to. When people are telecommuting, then you don't have to factor in the commuting time to the office. You don't you put away even some of your office clothes, and so all that anxiety comes in. But then also there are staff who are actually looking forward to coming to the office, and they will not be actually conscious of the safety concerns. So you will find two types of, two kind of categories among the staff. Those who are really conscious and anxious, almost afraid to come back to the office, but then there are those who have been waiting to come back to the office and may not really look into the safety measures. But what is important is, I think, managing, and what I would recommend most would be to return in phases, because the first phase, normally from my experience, it offers a lot of learning. Because you remember when we moved away from the office, the time the use of masks there was still a lot of controversy around the use of masks, around sanitization, around safety issues. So it's always important to get in small numbers. And once you get in small numbers, you'll be able to observe some of the obvious failures to correspond to the measures that you need for prevention. And then you can come up with ways that can practically be used to ensure that people are compliant to those measures. The other one, of course, is, of course, you have to look at your staff and then go one by one with them and find out how comfortable they are. Do they have any specific concerns around coming back to the office? You have staff with underlying medical conditions who may have concerns to come back to the office. You have staff who may have situations at home that are actually pushing them away from home, and the office is a kind of a safe space for them where they run away from maybe some of the challenges they have in their homes. So you have to balance all this, but the critical thing, the most important thing is the safety of everybody in the office, because you don't want to go back into the office and then after 1 week you have to close down the office again. And then of course the general mood of the population, because remember we are not working in isolation. As lockdown levels are lifted, people generally relax. So it's difficult sometimes for people to enforce measures within an office when the overall population seems to be relaxing and having a sense of safety. If you get cases where the numbers have gone down, like it's happening in South Africa now, the number of new cases has remarkably dropped, and you can see in the community, out in the public, the feeling of safety comes back to people. So that needs to be addressed as people come back to the office. Thank you.
Thank you so much, Michael. And I really liked what you said, that we have more evidence about prevention now than before the lockdown. And that means we should be a little bit more confident about coming back to office. I would like to remind all the attendees that if you have any questions, you can put it in the Q&A chat box. Thank you, Jennifer, for your question. So Jennifer from Nigeria has this question about, how you work from home, what do you do when your organization has lots of community level activities? And Jennifer, Visible Impact has also faced this problem, because we were just about to launch a new project with a community-based approach, and then the lockdown happened. So then, of course, we had to wait for a few months to see if there were lockdown opening any soon. And now we know that it's not happening any soon. So we communicated it with our donors, and we have shifted most of our community level activities to digital platform. However, it has its own limitations, but then, we are still hoping that some of the community level activities can be resumed in few months. So right now, those parts about training or orientation and the kickoff kind of activities, we have shifted it to a digital platform. But I think this is a very interesting question. So I'd like to hear from any of our speakers regarding what are your thoughts on this, like organizations that focus on community level activities versus those who have the privilege of working from home. So if you have your thoughts about what other ideas would come up, I think any of you can answer that.
Can I add something here?
Yes, please.
Yeah, so the biggest challenge running a community-based project is that most of our staff is not pro technology. They never use the Android, Apple phones, or what is Zoom. They don't know it. And when you are working on service delivery, you cannot do it digitally. So in any case, this is actually a biggest challenge for the community based that are working with staff from the grassroots level, as well as providing services to the community. And you have to provide the services. You cannot stop the services at any cost. And here is come that being a youth-led or community-based organization, we don't have reserve funds or extra resources, so we can provide them with the technological instruments or phones or something like that, so that when there comes a decision, when you say that, okay, what is important, money or health? People in Pakistan, the transgender people, are living below the poverty line, and the field staff have priority of having resources to feed their family, because then comes the parties, and where we decide that we have continue despite of what resources we have, and to what maximum prevention we do. And the most important thing is that despite of the crisis, there was not the flexibility in targets from the donors, that you have to fulfill the targets despite of the crisis. So yeah, this is a challenge that the community-based organizations are facing, that when the things cannot be done digitally.
Yeah, thank you, Sarah, for highlighting on that. If any of our other speakers would like to add to that. Yeah, if not, then maybe we can discuss about another issue that's about having the policies and guidelines in place. So, for example, we do not have a separate safety officer or separate HR officer in small organizations. So usually a program officer or one person is doing a lot of different kinds of work. But now, because there's a shift in the working style, we might be requiring new policies, and or it might be very like in the form of guidelines. But at this time, like, what are the things that we should definitely not miss out when we are communicating the change in the overall scenario and the working style to the staff? So any speakers can highlight on this part, like what are the immediate things that we need to do to ensure that we have communicated the change in the policies to our staff. Eric, Michael, Kunta, Vinsaro.
Yeah, maybe I can go first.
Yeah, thank you, Michael.
Yeah, so in terms of policies, and this is not limited just to the youth-led organization or the community organizations. I think COVID caught all of us kind of unaware, and we've had to adapt to working in the current context. But in all that we are going to develop for organizations, I think the most important thing is safety of the people working within the organizations, and there is plenty of already developed policies and guidelines. There are plenty of materials out there on safety, and that we should be able to adapt that to organizations. And I would like to appeal, especially for organizations or the bigger organizations that are supporting community-led organizations or youth organizations, to ensure that they provide that kind of technical support to them. The other one would be how do we ensure that there's continuity of whatever service we're doing. When Sarah was speaking, he talked about that they did not stop providing services during the lockdowns. So again, there's plenty of guidance out there on how we can continue services in different sectors. And I think what we need to do is to really ensure that these guidances are available to our community-led organizations or the youth organizations, and that we can simplify them and localize them to the local context where they operate from, so that they don't appear to be very theoretical policies and guidance documents. Thank you.
Yeah, thank you so much, Michael. So maybe I would like to hear from Kunta as well. We discussed about the challenges of working remotely and not working remotely. So is there any additions that you would like to have about what if the staff cannot operate remotely, or there are no circumstances where we can allow the staff to work remotely?
Ok. Merci, Menda.
Okay, thank you very much. Concerning telework and working from home, we put it was a challenge for us to put policies in place. A challenge that encompassed several aspects. First of all, this was really a first for the majority of staff. They had never worked remotely before. They were not used to working, not at all used to teleworking. But everybody knew how to use the different forms of communication because they were used all the time within the country, or rather with other country offices in the region. So the staff were totally at ease with the technology. But working from home, there were personal challenges in the sense that this happened to coincide with the month of March. But most Sahara countries and the different electricity cuts can last for hours and hours or even the whole day long. But when people are working from home, they would not have generators at home in order to even have the electricity. So teleconferencing was just not an option for a lot of the time. So we were working on documents together, and so the staff, there were staff who didn't even have electricity at home. So to complete what, add to what Eric was saying, so we could help them with giving them some money for communication and better connections. But beyond all of that, since this was, given that this was our very first time that people had to figure out the intersection between family life and professional work at home, every Monday we would have meetings where we would discuss different challenges that working from home posed. We would share of that. So every week with the entire staff, we would discuss these challenges. Sometimes they would follow by telephone, and they had to make sure their telephones were charged. Assuming that, we also, beyond that, put into place some measures to listen, to share each person's feelings. So actually, we put into place a survey where each person indicated their personal challenges at home. There was issues of domestic violence or physical sometimes. So we took a census of all of these different challenges. And so some people began actually coming into the office, but on a rotating basis. So, while all the while respecting social distancing in the office. Thank you very much.
Yeah, thank you, Kunta, and thank you for highlighting on the. Yeah. So yeah, thank you for highlighting on the part of electricity, because even when we were having this webinar, there was electricity cut in my place, and then it's just come up. So I don't know if you have noticed that in the video, but that's just an example of how sometimes, you're having a very important meeting, and then because of these power cuts, it might not be very easy to work from home. So after that, I would like to turn to Eric again, because there is a lot of interest about the psychosocial effect on the staff. So I was wondering, because you have touched a little bit on that already, but I was wondering if if you have observed any kind of psychosocial impact on the staff or your colleagues that that's been attributable to COVID-19, and if yes, what are the measures that you are taking to ensure that the staff and your colleagues have mental health safety?
Sure, sure. Thank you for the question. I think we are observing among some staff some burnout just from working so hard for so long. I think when the pandemic first struck and we all started working from home, we sort of had this adrenaline rush, which helped us get through the first month maybe or two of the pandemic. But then as things kind of started to settle in, and we realized that this is going to be a long-term state of affairs, I think people are starting to burn out a little bit. And so we're, like I mentioned earlier, we're really encouraging people to take advantage of the counseling services that we offer through Conterra, our external counseling provider, as well as making sure that people are taking time off during the day, that they're being flexible, that our managers are being flexible with their staff, and that people are taking vacations whenever they can. So those are some of the measures that we've been taking, and really trying to instill in our organization a culture of caring for our staff. So unfortunately, it's been hard for me to observe this in person because, of course, we're all working remotely, and the best that I can do is observe people on a screen like we have here right now. And you don't pick up on some of these things in the same way when you're online as you would if you were in person. So, but nonetheless, those are some of the things that we're doing.
Yeah, thank you on highlighting the importance of having the culture of care. And sometimes like bigger organizations do have the resources to even have a separate psychiatrist or psychological counselor. But even for visible impact, like we have been offering, because there are several organizations that are offering free psychosocial counseling. And then, we have been trying to link our staff to those resources because we do not have the capacity to have separate psychosocial counselor, but it's really great that some of the large organizations are offering, free psychosocial counseling. So thank you for highlighting on that. And so I would like to turn to Saro now because you have a question from Anushka Kalyanpur from CARE. Firstly, she would like to express her sincere thanks to you for your insights and leadership during this challenging time. And her question is that, what key asks would you have for other partner organizations? Because you have talked about the importance of needing greater flexibility from donors. Do you have any other key asks and recommendations for how INGOs and UN organizations can amplify the efforts of youth-led organizations? So over to you, Saro.
Thank you so much for the question. I will continue from the previous question towards this question. Like when we talk about the psychological impacts of the crisis, I will share literally that people think that I got COVID-19 because I'm a transgender. These type of stereotypes that we have faced, discrimination and stigma attached with certain communities and the COVID-19. And we, as you said, that we being a community-based organization, we don't have enough resources to get the psychological supports, but we as a community make a chain to keep the momentum on and to support each other. And even when I was in isolation, other community member who just get recovered from the COVID-19 was helping me out at how to take care of yourself in COVID-19. And coming towards that, what recommendations I have is that, number one, there should be the flexibility towards the youth-led small community-based organizations when it comes to resource mobilizations, because I have seen that the big organizations who have all the legal documents and things have a lot of funds in their reserves that they can continue, they can sustain their organization for even 2 to 3 years. But being community-based organizations, we cannot even sustain for 2 to 3 months by our own self. We need resources to sustain. And I think that there should be the network and coalition building in this time of crisis of all the, for instance, the community-based organization in South Asia, and we can develop the recommendations and support each other in terms of technical and mobile resource mobilization as a consortium to influence the donors to take into considerations the
Hi, Saro. Yeah, okay, so there was a little bit of cut in between. So yeah, thank you so much for, highlighting the challenges that youth-led organizations and CBOs are still facing. And from your experience and from mine as well, it's mostly about connecting with the donors, and sharing our concerns and experiences and seeing if there is like space for donors to support us. So I think that will bring us to our final, yeah. That will bring us to probably the final questions I have to all the speakers. So, because you work with UNFPA, Save the Children, and CARE. So I was wondering, responding to Saro's and my concerns as well, how can organizations like yours support organizations like Saro's and mine? So can we start with Michael?
Yeah, thank you. Yes, so one of the ways we have recommended at UNFP that we can support such organizations is to have flexibility in terms of the requirements for engaging them as implementing partners. So the flexibility is there for local organizations in terms of having them come on as grantees, as opposed to implementing partners where the requirements for them to engage with UNFP would be very, very laborious. As Sarah pointed out, they would need plenty of documentation and so forth. So then that allows, it allows UNFP to work with such organizations and also support them to develop their own capacity in terms of the legal and regulatory requirements that they need to come on as an implementing partner. And we have seen a number of smaller community-led organizations grow through that kind of flexibility and support into real-time, full-time implementing partners for UNFPA. The other option also is within emergencies or during crises like COVID-19. We have procedures that allow us to set aside some of the requirements to engage implementing partners. So again, during times like this, we have reached out to some organizations in some countries and we've been able to engage them to have small grants to this organization. Then they can engage in some of the activities that we as UNFPA would not be able to implement in the current status. For example, if there is a lockdown, it's more likely that a community-led organization is able to continue with some activities as opposed in a better way than a big organization which has lots of security and restrictive kind of regulations. So that's how we try to work around and see how we can support youth and community-led organizations. Thank you.
Thank you, Michael. So over to you, Kunta, with the same question, like how can organizations like CARE support organizations like Saro's?
Allô, vous m'entendez?
Can you hear me? Says Kunta. Hello. Can you hear me? Says Kunta.
Yes.
Oui, ça marche.
Ah, ok, d'accord.
Okay, great.
Ok, pour répondre à cette question, je vais compléter.
I'd like to answer to that question by adding to what my colleague has said. It is true that we should be more flexible in terms of procedures that could help move things along. But we have to remember that these procedures were very important to secure funds and also to ensure accountability. Now, beyond that aspect, I think it's crucial to support local organizations. I gave you the example of organizations that help support young women. Sometimes these organizations are there, but they don't have enough ideas. They don't know how to take the initiative. Sometimes they don't have the courage to go and talk to the big NGOs and to raise issues. This is why larger organizations should also communicate with them. We all go through the same situation throughout the world in every sector. And there are some things that we can do, some activities can be carried out. So we have to know which type of support those local NGOs need. I think that this type of support between NGOs on the local and international level are very important. Internationally, this can also help develop new programs. So I think it would be useful to have a type of permanent contact between the international NGOs and the small NGOs that are community-based. When the needs are communicated from the ground up, then the investment is more adequate. The investment really takes into account the local needs of the NGOs. So we can have a bigger impact and better results. Thank you.
Thank you so much, Kunta. So I'd like to turn to Eric with the same question, like how can Save the Children support organizations that are youth-led and community-based?
Well, I think we do a lot of that through our grant, through our sub-grants on some of the projects that we're working on. I know that we're operating, a couple hundred projects in probably 60 or 70 different countries around the world. And we do offer, particularly the partners who are involved in the same areas where those projects are aimed at helping. We will engage with local partners to implement those projects.
Yeah, thank you. Thank you, Eric. And what I hear from all the three of you is that, youth-led organizations or CBOs shouldn't be shy to share their concerns with the donors, because I see that even the donors are willing to understand the situation and are willing to, have sort of flexibilities around what we promised in the project in the very beginning. So that's a very big lesson for me. Having said that, we are almost towards the end of this webinar. So I'd like to thank all the four speakers. You have been really wonderful. There was a lot of learning, and I've taken notes of few points that I look forward to bringing back to my organizations. And also to all the attendees for being really patient and coming up with really wonderful and important questions. But I think this is just the beginning of the conversation, because these conversations need to get going. And we are also doing that with other sessions in our series. So if you remember, Katie said in the beginning that it's a three-session series. So today was the first part. In the second part, we are going to talk about safety first, operations a close second, where we'll be talking about how to continue your organization's operations. Figuring out what activity to continue and or adjust for during COVID. And the third session is going to be about getting ahead. So this session will help you go through preparation steps, including how to fundraise and communicate with donors and think through actions for the next emergency hazards, such as, there might be second wave of COVID. So keep looking out for for FP2020 and IAWG to have updates about these webinars. And also this session has been recorded and it will be shared with other materials and notes that have been discussed in follow-up communications. So thank you so much, and I really look forward to joining you in the other two sessions as well. But if you remember in the very beginning, Katie had also shared about a funding opportunity. So now I think it's time that we hear from her what the opportunity is and what the application process looks like. So over to you, Katie.
Ça va?
Thank you so much, Medha, and thank you everyone for making this such an engaging conversation. So the funding opportunity is on the screen. This is for small one-time grants that IAWG is supporting. And again, that's just the Interagency Working Group for Reproductive Health and Crises. And so we're providing two $2,500 to $3,000 grants for operational needs. So we're hoping that we can support around 15 to 20 organizations with these small grants to help you with things like if you need a Zoom license to have some meetings online, or perhaps as some of the concerns raised with Medha and Saro regarding laptops, and your organization has one person who does many roles and they weren't used to working remote, and so you could apply for things like office furniture for them to work remote, or additional laptops for your staff to work remote. This funding does not cover programmatic needs, so we wouldn't want you to be applying for sexual and reproductive health commodities, but anything that's related to COVID operational needs. So if you do need some personal protective equipment, some masks, you could apply for funding for that. And this is limited just to you all, to youth-led organizations and community-based organizations serving young people. And finally, we are prioritizing organizations that are serving the most vulnerable adolescents and young people. So if your organization is doing programming serving refugees or displaced persons or people facing humanitarian situations, we will be prioritizing those organizations. In terms of how to apply, we will have an online application and we'll be sharing that out with everybody who registered for this series. And just putting in another plug to please register and share this information with your other youth-led organizations and friends. We have 2 more exciting sessions coming up, and we hope you'll be able to join. Thanks, Medha.
Great, thank you, Katie. That sounds really exciting. So yeah, with this, we have come to the end, and thank you all for attending, and we look forward to seeing you again on the next series. Have a good morning, good day, good evening, depending on which part of the world you are. Have a good rest of the day, and bye-bye.